founder and CEO of a company called Reformulary Group, which is essentially in the area of prescription drugs and building a plan for employers, for instance, and others. And we've built this consumer digital platform around drugs.
Why is there a need for something like that today?
There's a need because as a country we spend a lot of money. We spend $35 billion on drugs, and there's relatively, from a consumer perspective, we don't really have access to a good objective review of which drugs are better than others. And so considering our spend and also considering that definitely some are better than others, it's a real need.
How far do you go as far as information, in terms of which drugs are better? Do you also give people educational information around which drugs you shouldn't take with other drugs? Does it go that far?
So what we do is we have invested about 50,000 hours of clinicians' times in reviewing all the drugs, comparing one drug to the other. What a lot of consumers wouldn't know is that for any medical condition there could be hundreds of drugs to treat it, so there's lots of alternatives. And so what we've done is we've done all that research and that homework, and we basically then put it into this digital platform so people can look up what are preferred, what are non-preferred, and what are the alternatives. Now where we haven't gone is with respect to drug-drug interactions, which I think is really the latter part, and that more relates because as individuals, when we take our prescription to the pharmacy, it's really the pharmacist then that would know what are the other drugs you're taking. But to the extent we can guide people to drugs that provide the best value, that's our focus.
It's interesting because one would assume that information was out there anyway, that we should have had access to that, but clearly that's not the case.
Absolutely, I agree with you 100%. And so our Drug Finder, our tool is called Drug Finder, that's really intended to give it. But I mean, arguably to your point, healthcare is really the last frontier, whereas consumers, we have very little access to our health information and very little access again to, one drug compared to another, etc.
What are some of the issues that have arisen over the years because we haven't had that access?
So to a great extent, and part of the real opportunities now is that we have a lot of very high-cost drugs. We have higher-priced, high-cost drugs. And so it's putting a lot of pressure on plans, both the provincially funded plans, but also plans that employers provide to their employees. And so as a result of not having that information, we've had, for instance, as we call it, just an open list of drugs, so you can have whatever you want no matter how much it costs. And that as a result has put a lot of pressure, and there's real issues around sustainability these days.
I'm always interested in terms of when people are growing businesses, what attracts them to growing a business like this? For you, what is that thing?
So I had I've spent my career in healthcare. I had a 5-year stint in government, actually in the Ontario government, disrupting the whole prescription drug system, which we did in a very significant way. And so when I left that, I then looked at the private sector and thought there's a real, it's a bit of the Wild West, there's a real opportunity here to bring more rigor. And so that's why I founded Reformulary Group, and we subsequently then really saw the opportunity to bring this, our Drug Finder tool as a tool to consumers.